Required vitamin if you have vertigo. Have you ever wondered why the world seems to spin when you move your head? Have you experienced sudden vertigo when lying down or getting up from bed? Is there a simple solution to this uncomfortable sensation that affects so many people? Benign paroxysmal positional vertigo, BPPV, might be the answer to these questions, a condition more common than you might think, but one that few fully understand. What if I told you that a vitamin could be the key to preventing these episodes? Yes, there's a little-known secret that could change your life. Why is this vitamin so important, and how can it help prevent new episodes of vertigo? The answer might surprise you. Don't miss the chance to learn how to protect your balance and live without the fear of these bothersome sensations. Important! We've listed all the references used to create this video in the description for you to access whenever you want. Let's get started. The secret few know about benign paroxysmal positional vertigo. Benign paroxysmal positional vertigo, BPPV, is one of the most common types of vertigo, characterized by the sensation that the surrounding environment is spinning, especially when you change the position of your head. It occurs due to a dysfunction in the inner ear, specifically in the semicircular canals, where small calcium carbonate crystals, called otoliths, dislodge into areas where they shouldn't be. When this happens, they wrongly stimulate the sensory cells, resulting in vertigo. This type of vertigo is described as paroxysmal because it occurs suddenly and intensely, positional because it is triggered by changes in head position, and benign because, although uncomfortable, it is not a serious condition and can usually be treated successfully. BPPV is more common in older adults but can affect people of all ages. BPPV episodes usually last less than a minute but can be frightening and debilitating. It can be confused with other vertigo conditions, such as Meniere's disease, but it is important to get a correct diagnosis, as the treatment for BPPV is specific and effective. Proper identification of BPPV can quickly relieve symptoms and improve the patient's quality of life. Did you know? This is the main cause of your vertigo. The exact cause of benign paroxysmal positional vertigo, BPPV, is not fully understood, but it is closely linked to the abnormal movement of otoliths within the semicircular canals of the inner ear. Normally, these small crystals remain in a structure called the macula, located in the utricle, where they play a role in balance. However, when these crystals move into the semicircular canals, which are responsible for detecting rotational head movements, they can cause a false sense of movement, resulting in vertigo. The displacement of otoliths can occur for several reasons. One of the most common causes is aging, which can cause changes in the structure of the inner ear, making the otoliths more likely to dislodge. Other causes include head trauma, which can force the crystals into the semicircular canals, and previous vestibular diseases. In some cases, BPPV can occur after an ear infection or even after long periods of bed rest, such as after surgery. Although it is often impossible to identify a specific cause, understanding the factors that can lead to the development of BPPV helps in diagnosing and managing the condition. Knowing what can trigger episodes is crucial for preventing recurrence and for applying repositioning maneuvers, such as the Epley Maneuver, which can move the crystals back to their correct place, relieving symptoms. This symptom reveals if you have BPPV. How to find out? Identifying benign paroxysmal positional vertigo, BPPV, can be challenging, especially because its symptoms can be confused with other forms of vertigo. However, there are specific signs that may indicate the presence of this condition. The main symptom of BPPV is intense and short-lived vertigo that occurs in response to changes in head position, such as lying down, getting up from bed, looking up, or turning over in bed. These episodes usually last less than a minute, but the feeling of imbalance may persist for some time after the initial attack. Another indicator is nystagmus, an involuntary eye movement that occurs during a vertigo episode. Nystagmus is an important sign for doctors because it indicates that the semicircular canals of the inner ear are being activated abnormally, as happens in BPPV. Clinical tests, such as the Dix-Hallpike maneuver, are often used to provoke nystagmus and confirm the diagnosis of BPPV. If you experience episodes of vertigo associated with changes in head position, it is important to see a doctor, preferably a specialist in otolaryngology or balance disorders. Proper diagnosis is essential to receive the correct treatment, which can relieve symptoms and significantly improve the quality of life. Don't ignore the symptoms, even if the episodes are brief or spaced out, as BPPV can be easily treated with the appropriate maneuvers. Epley Maneuver, the simple trick that ends vertigo. The Epley Maneuver is a technique for repositioning otoliths used in the treatment of benign paroxysmal positional vertigo, BPPV. This maneuver was developed to move the small calcium carbonate crystals, otoliths, back to their correct place in the inner ear, relieving vertigo symptoms. The technique is simple, non-invasive, and can be performed in a doctor's office or even at home with proper guidance. The Epley Maneuver consists of a series of sequential head and body movements that use gravity to guide the otoliths out of the semicircular canals and back to the macula, where they belong. The procedure begins with the patient sitting and the head turned 45 degrees to the affected side. Next, the patient is quickly laid back with the head hanging back, still turned in the same direction. After 30 seconds, the head is turned 90 degrees to the opposite side, and the body is then rotated so that the patient is lying on their side with the face turned towards the ground. Finally, the patient returns to a sitting position. Although the Epley Maneuver is highly effective, often resolving symptoms in one or a few sessions, doctors commonly recommend that the patient avoid certain head movements for a while after the procedure to prevent the otoliths from dislodging again. The effectiveness and simplicity of this maneuver make it one of the top choices in the treatment of BPPV, the vitamin that can change everything for those with vertigo. The relationship between vitamin D and benign paroxysmal positional vertigo, BPPV, has been the subject of several studies in recent years, revealing an important link that can influence both the occurrence and recurrence of this condition. Vitamin D plays a crucial role in maintaining bone health, including the formation and metabolism of otoliths, the calcium carbonate crystals in the inner ear. Adequate levels of vitamin D can help prevent these crystals from dislodging, which is the main cause of BPPV. Studies show that individuals with vitamin D deficiency have a higher risk of developing BPPV. Additionally, those who already suffer from the condition and have low vitamin D levels are more likely to experience recurring episodes of vertigo. Correcting this deficiency through vitamin D supplements or adequate sun exposure has been shown to effectively reduce the frequency of new BPPV episodes. Therefore, vitamin D supplementation is not only beneficial for overall health but can also be an important preventive strategy for those at risk of developing or already suffering from BPPV. Maintaining optimal levels of this vitamin is a simple and practical measure that can significantly impact the quality of life of patients by reducing the incidence of vertigo and the need for repeated treatments. Vitamin D, the best defense against vertigo you need to know about. Vitamin D, mainly known for its role in bone health, is now considered essential in managing benign paroxysmal positional vertigo, BPPV. The importance of this vitamin goes beyond preventing osteoporosis. It is crucial for the integrity of otoliths, the small calcium crystals responsible for balance in the inner ear. When these crystals dislodge, BPPV occurs, causing debilitating episodes of vertigo. Recent research indicates that vitamin D deficiency is associated with an increased risk of BPPV. This occurs because low vitamin D levels can weaken the structure of otoliths, making them more likely to move into the semicircular canals of the inner ear, resulting in vertigo. Furthermore, restoring vitamin D levels in deficient individuals has been shown to reduce the frequency and intensity of vertigo episodes, making this vitamin a fundamental part of BPPV treatment and prevention. Therefore, vitamin D should not be overlooked, especially for those who already suffer from vertigo or are at risk of developing it. Proper supplementation, sun exposure, and consuming foods rich in vitamin D are simple yet powerful strategies to maintain balance and prevent new episodes of BPPV. Consulting a doctor to check vitamin D levels and, if necessary, starting supplementation can be a decisive step towards symptom relief and long-term prevention. Discover the secret triggers behind vertigo. Various factors can trigger benign paroxysmal positional vertigo, BPPV, a condition marked by sudden episodes of vertigo that usually occur after rapid changes in head position. The main cause of these episodes is the displacement of otoliths, small calcium crystals in the inner ear, into the semicircular canals where they don't belong. This displacement can be provoked by various situations, ranging from aging to specific medical conditions. Aging is one of the main risk factors for developing BPPV. As we age, the structure of otoliths can change, making them more likely to dislodge. Head trauma, even mild, is also a common trigger, as the impact can force the otoliths to move. Additionally, ear infections, previous vestibular diseases, and long periods of bed rest, such as after surgeries, can increase the likelihood of developing BPPV. Sudden position changes, such as quickly getting out of bed or tilting your head back, are typical triggers for vertigo episodes. Therefore, it is important to be aware of movements that can provoke BPPV, especially if you have already been diagnosed with a condition. Understanding these triggering factors is crucial for avoiding new episodes and effectively managing the condition using appropriate treatments, like the Epley Maneuver. Are you at risk? See if you could develop BPPV. Benign paroxysmal positional vertigo, BPPV, can affect people of all ages, but certain groups are at higher risk of developing this condition. The main risk factor is age, with most cases occurring in people over 50. As we age, the structure of the inner ear, including the otoliths, can deteriorate, increasing the likelihood of these crystals dislodging and moving into the semicircular canals, causing vertigo. In addition to age, other factors can also increase the risk of BPPV. People who have suffered head trauma, even mild, are more likely to develop the condition since the impact can destabilize the otoliths. Individuals with a history of ear infections or vestibular diseases are also at risk, as these conditions can damage the inner ear, making it easier for otoliths to dislodge. Additionally, studies indicate that vitamin D deficiency may be a contributing factor since the vitamin is essential for otolith health. While BPPV can be unexpected, knowing the risk factors can help with prevention and early diagnosis. If you belong to any of the risk groups mentioned and start feeling vertigo when changing head positions, it's important to consult a doctor for evaluation. Early identification of BPPV allows for effective treatment and symptom reduction, improving quality of life. The hidden signs of BPPV you need to recognize. The symptoms of benign paroxysmal positional vertigo, BPPV, are quite specific and usually easy to recognize, although they can be mistaken for other forms of vertigo. The main symptom is intense, short-lived vertigo that occurs when the head position changes, such as when getting out of bed, lying down, or turning over in bed. This vertigo is usually described as a sensation that the environment is spinning and may be accompanied by nausea, imbalance, and in some cases, vomiting. Another characteristic symptom of BPPV is nystagmus, an involuntary eye movement that can be observed during a vertigo episode. Nystagmus occurs because the semicircular canals of the inner ear are sending incorrect signals to the brain due to the displacement of otoliths. While nystagmus can be detected by a doctor during an examination, it can also be noticed by the affected person as difficulty focusing the eyes during a vertigo attack. In addition to vertigo and nystagmus, some people with BPPV may experience a sense of imbalance or instability, especially when walking or standing, even after the acute episode of vertigo has ended. These symptoms may persist for a few hours or days, but are usually temporary. If you experience these symptoms, it is important to seek medical evaluation, as BPPV can be effectively treated, relieving symptoms and preventing future episodes. Effective treatment. How to get rid of vertigo once and for all. The treatment of benign paroxysmal positional vertigo, BPPV, is highly effective and usually involves repositioning maneuvers, such as the Epley Maneuver, which aims to move the otoliths back to their correct position in the inner ear. These maneuvers are performed by doctors or specialized physical therapists and consist of a series of head and body movements that use gravity to realign the crystals that cause vertigo. In many cases, a single treatment session can resolve the symptoms, although some patients may need additional sessions. In addition to repositioning maneuvers, doctors often advise patients to avoid certain abrupt head movements for a few days after treatment to ensure that the otoliths remain in their correct position. In more persistent cases, medication may be recommended to control symptoms of vertigo, nausea, and vomiting, although these do not treat the underlying cause. For patients with vitamin D deficiency, supplementation may be part of the treatment, as adequate levels of this vitamin have been associated with a reduction in BPPV recurrence. In rare cases where repositioning maneuvers are not effective, surgical treatment may be considered, although this is uncommon. Early diagnosis and appropriate treatment are crucial for relieving symptoms and preventing BPPV recurrence, allowing the patient to return to their normal activities with confidence. The first step to a life without vertigo. Benign paroxysmal positional vertigo, BPPV, is a common but often underestimated condition that can significantly impact quality of life. Fortunately, with proper diagnosis and treatment, BPPV symptoms can be effectively alleviated, allowing patients to resume their daily activities without the constant worry of sudden vertigo episodes. Accurate identification of BPPV, distinguishing it from other forms of vertigo, is crucial for applying the right treatment, such as the Epley Maneuver, which is simple, safe, and highly effective. In addition to repositioning maneuvers, preventing BPPV may involve vitamin D supplementation, especially for those at risk of deficiency. Maintaining adequate levels of this vitamin can not only strengthen the otoliths in the inner ear, but also reduce the chance of vertigo recurrence, providing lasting relief. For those who have already experienced BPPV episodes, understanding the triggering factors and avoiding movements that might cause otolith displacement is an additional preventive measure. In summary, BPPV is a treatable condition, and with the right strategies, those suffering from this vertigo can find effective relief and prevention. If you or someone you know is dealing with vertigo symptoms, don't hesitate to seek medical advice. A correct diagnosis is the first step to regaining balance and peace of mind. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.